Welcome to Professor Sutton from Imperial College London, and to Professor Boon Lim, Clinical Lead for the Imperial Syncope Unit at Hammersmith Hospital, both members of STAR's Medical Advisory Committee. Thank you for joining and for being available for patients.
Good morning, Trudie. Thank you for having us.
Good morning.
Good morning.
Good morning. All too often we hear in the news of a young person dying suddenly, unexpectedly. Maybe the only history they've had is fainting. But upon further investigation, often there's a history in the family of sudden death, maybe the grandfather, the brother, the uncle. Could you tell me if there's any link between syncope and sudden cardiac death? And we did mention that syncope can be a symptom.
Trudie, thank you for raising this very, very important point. The history that you've just given is, to my mind, a very strong red flag. There are a group of cardiac conditions which can be inherited, and these cardiac conditions can lead to an increased chance of sudden cardiac death. One of the presentations prior to sudden cardiac death could be syncope or an aborted sudden cardiac death. And these are typically cardiac causes for syncope. At the start, we discussed about reasons why one might faint. We know there's no such thing as a simple faint, but the condition of vasovagal syncope contributes to the majority of patients that are seen with syncope. And so the healthcare professional would probably have a bias in terms of the frequency or the how common fainting is attributed to vasovagal syncope, or what is called a simple faint. Now, there are a group of patients who faint without vasovagal syncope, but with what we call cardiac syncope. Now, cardiac syncope can be lethal. And when you're confronted with a patient with a history of syncope, which can be as a result of a cardiac cause, and Richard earlier on explained that it can be due to the heart rate or rhythm being too fast or too slow. So for example, bradycardia, or a patient's heart being so slow with complete heart block that they will faint unless they get a pacemaker. That's one cause. The other cause is when a patient has had a heart attack, for example, and has an impairment in pump function and has the propensity to develop rapid heart rhythms called ventricular tachycardia. That can also cause fainting, which is quite dangerous. But the group of patients that you described specifically, Trudie, who have had fainting and who have had a family member die suddenly, for example, in their 30s or younger, that immediately raises the suspicion of an inherited cardiac condition. That could be something like a channelopathy, which is a complex way of saying that there's something wrong with the electrical. So, you know, when we have our heartbeats that is generated by ions such as sodium and potassium, and the most common abnormalities in those channels that allow the flux of these sodium and potassium ions that generate your cardiac impulse is a reason, for example, for sudden cardiac death, especially when there's a family member who's also had that. So the conditions which are common would be Brugada syndrome, would be long QT syndrome, for example, that can cause sudden cardiac death, and that will need ruling out. If you have these syncopal attacks, but a family history of sudden death, I think you must see your GP and must make it known very clearly that there is this risk factor which you consider a red flag. There are another group of conditions which are structural, as Richard said, and that is to do with the muscle of the heart not being laid down in a normal way. So for example, the condition of hypertrophic cardiomyopathy or arrhythmic right ventricular cardiomyopathy are two such examples of a problem with the heart muscle. So when the heart muscle doesn't contract as well, or the heart muscle is too thick, it's not the usual size, that can increase the risk of arrhythmias, in particular, the ventricular tachycardia type of arrhythmias, which are a red flag group of diagnosis. So sudden cardiac death in a family member, in summary, Trudie, should always be taken as a red flag. And if you have syncope, ask to see a cardiologist.
And a cardiologist with a specific interest in heart rhythm disorders as well. But again,
yes, so I would say, yes, I would say yes.
Yeah, and we cover that in the STARS checklist as well. So we will make sure the STARS checklist is available.
Yes, that's right.
Next to these educational videos. Thank you, Professor Lim.